What's going on? I'm sure you people are not tired of seeing my face at all after last night, but welcome back to the Poor Pearls Almanac Twitch channel, also brought to you by Facebook, YouTube, Twitter for some reason, and I don't know who else. But thanks for joining us. We've got a good audience popping in, so I'm pretty excited about that. So obviously we've been talking about like all these different types of skills that we should have. And we focus primarily on like actual hands-on like skills you can use today in terms of like being able to knit something or fix something or grow something. And those are all really important, but also we should be thinking about some of the bigger picture skills that everyone should have, not necessarily because you're going to use them every day, but there may be a point where you need to use them. And it's much more serious than whether or not you can grow mushrooms out of an old straw bale or whatever. So today we've got a very special guest, somebody that we've known for a very long time. You guys may or may not follow them on Instagram, and if you don't, you should, because they're fantastic. They also do a lot of really great work in creating audiobooks and things like that. So if you're not supporting or following or anything with ListenLeft, you're failing. So go do that. So I'm going to introduce them. I'm not sure. I should have asked before what she wanted me to call her. But welcome, ListenLeft.
Hi, I'm Liz. I'm one half of ListenLeft officially, but yeah,
It's Liz and Left, I believe. Then
it should be if
right.
you know. Yeah.
So first off, thanks so much for coming on. I'm super happy to
Thanks for having
have you
me.
here. This is something that I know literally nothing about, so I'm going to be like your doe-eyed student who asks all of the stupid questions. So
No,
I will do
please
that
do.
for all of the audience so that you guys don't have to.
I think that's preferable for
I
me.
wanted to do that the other way. There we go. So, so now, I guess I want to ask a little bit of like where did you get this information and kind
Why do
of
I know this?
why do you know this, and also like kind of within a context of history, like how has this knowledge been known?
Sure. Oh, well, that those are two very important things. First, how came to do it is that I actually had my first baby when I was 16 and I dropped out of high school and I was like kind of not sure what to do. And I started doing doula work when I was young. I was like 17 and I started doing that voluntarily to learn, and that led me to meeting a midwife. And I worked with her in doing home births in and around Central PA. So like a lot of Amish clients, a lot of like academics, and then a lot of really rural people in the mountains. And I did that for about 3 or 4 years, and then have been doing like nonprofit and academia stuff since, but studying kind of the inequities around birth and motherhood and parenthood in the country and things like that.
Awesome.
Access to midwifery care.
Yeah, it's very interesting that I don't the whole ecosystem around birth is just like very interesting in the way it's been structured based on our modern understanding of like our relationship with our bodies. So
Absolutely.
so I want to ask, like, I think midwifery and like all the skills that you brought up, we have like a very skewed understanding of what those things are,
Mhm.
and kind of like where their place is in like modern medicine. I find it we or at least in my own experiences, when I think of midwives, I usually think of like hippies, and
Right.
like that's, I guess,
Mhm.
probably partly accurate, but also I'm sure there's like a lot more to it.
A lot of context. There is, and it's funny. That's part of what like my research focused on when I was doing that, particularly in school, in the year um, and it was and it was something that made me uncomfortable when I was practicing. And midwifery is kind of considered now like the rich white woman sport. And that's because to do it, you have to apprentice, and it's typically unpaid. Oftentimes, there's a national licensure, even though not all states um, recognize it. And so in some states, to practice midwifery without a license is a felony. In some states, it's the legal gray. Like it, I don't know, whatever. There's a national licensure, and you need a certain number of births, a certain number of prenatal visits, and a certain number of postpartum visits. And there are a lot of people who apprentice who will go down to Texas and go to some birth centers there that kind of use like an immigrant population, and without like knowing a lot about their history, maybe not even speaking their languages, and just to get their numbers. I don't know. There's a lot about it now that
It's been
I don't know.
commodified.
And then the people who can usually access home birth, which tends to be safer than hospitals for a lot of reasons, are also usually wealthier white women, who may be kind of hippies. And that's the thing. When birth in the US shifted to hospitals, which really didn't happen for most of the country until like post World War II. And it, but a lot of like granny midwives who were still practicing were Black and were Southern or Indigenous. And so some of the hippie women learned from them, and kind of the hippie white women, and started a midwifery resurgence that became kind of more fringe, if that makes sense. But traditionally, midwives are more full spectrum healers.
Yeah, I
That was a
yeah.
lot.
No, it's really interesting. I don't, because like I said, I literally don't know anything about this, so this is all new to me, and my
Yeah.
brain's like running in like 10 different directions. And I like think about like my dad was born in his house, or the house he grew up in Italy, and like that was like the norm. And I remember
It was.
when I was there, the first time at least, my dad's uncle was like, "Oh, your dad was born over in this house," and it's like this like house that's like built into a hill, and I'm like, he
Right,
was born in there, like it doesn't have windows, and like, it's
right.
just like it's we're so like because of the modern industrialization, or commodification of like medicine, we assume that like you have to be in this like very like pure and clean environment, or there's just like all of this risk.
Carol. Mhm.
Yeah. Um
No, you're totally right. And and I love how you brought up earlier about how disconnected it makes us from our bodies. Like or how disconnected we've become. And I think birth is probably one of the birth and things like abortion, miscarriage, anything like that. They have become some of the ones that we disconnect ourselves from the most. And I don't know, it's such like a physiological process, an emotional process for a lot of, I mean, really most of the world. It's been a sacred process. It's been a lot of things. And um we literally like numb ourselves from it. And um it's, I don't know. Yeah, it's difficult. It's, I don't know. It's changing how we kind of function, because it's meh, I don't know.
yeah, it's, I mean, you're absolutely right. We have changed how we relate to ourselves and one another, and our own autonomy over our bodies in a lot of
Right.
ways. Like we don't have the authority, and I mean, I guess I'm a guy, so I also don't have any authority in that sense. But like, for women to have lost the, not just through like abortion restrictions and things like that, to have lost those rights over that bodily autonomy, but also to have any really authority, unless you're a rich white woman, on what your birth looks like and the relationship you want to have with that process.
No, exactly. And it's, I mean, I think that's the thing too, is that I saw someone said something like a lot of people who are giving birth say drug me up. But I think that's the thing that I'm actually in school now to be like a couples and um sex therapist, which was such a part of midwifery and vice versa. Unfortunately, like part of why I had to stop was because I couldn't afford to not get paid while I was training. I didn't have people to watch my children. Like it was I was, I
Which
couldn't
goes
do it.
back
And
to that
but
whole
I
like
did.
hippie thing.
Right. I mean, I would do free doula work then for friends for years, but it just, but anyway, um, and I think I forgot what I was saying. Oh, but the other thing about being in hospitals and being so disconnected from our bodies, and something that we forget, is like there's a dysphoric aspect of it. A lot of us have experienced sexual abuse. And so it's like we live with so much trauma as it is, and birth, and I've seen it happen, is like can be incredibly healing and transformative for people. Um and healing, it also has the possibility to do, more or even new damage when you're, I don't know, being subjected to things without your consent, which happens a lot in hospitals. There's such a spectrum of treatment. If you're on state insurance, if you're not white, if you're poor, if they suspect you to be a drug user, which, with any of those things, they just, it does. Yeah, there's a lot that's removed.
Yeah, and I guess to circle back to this conversation about emergency
Right.
abortion and birth care, when we talk about like building skills to be prepared for the fact that like clearly the state is swinging in a very specific direction, whether or not is reelected, which I am very doubtful of. Like
Yeah,
I think that the future, the recent present we've had is not going to exist for much longer in terms of access. And as things
exactly.
like our healthcare system, which is obviously like falling apart under COVID,
Quickly.
if it
Yeah.
ever recovers, that may be decades from now, and that's a big if, just based on like the statistics of nurses that have died, CNAs that have died, people
Maternity
that have
wards
left.
closing down. Yeah.
Exactly. So like I feel like this skill is like much more pertinent than people want to give it like credit for, in the sense of like, again, me as a white guy, like, why do I need to know about birth care and like abortion care? Like, that's not my body, but also it absolutely is my responsibility to have those skills and knowledges, because of the fact that like we are on the precipice of something really big. And I think this is something that is, we all talk about like women's rights and blah blah blah, but like what are we doing to like ensure those rights, whether or not the state gives us authority to do that?
Right. No, well, you're so right. I mean, that's the thing. I think I feel like I could have like 1,000 discussions on how we conceptualize choice and bodily autonomy around um full spectrum reproductive rights in general. And that's like its own thing, because I think even the left can view it through a lens that isn't as nuanced as it should be. But anyway, you're right. And the other thing, we're seeing it now, a lot of maternity wards are closing down. A lot of people in rural areas, you know, already sometimes would have to travel pretty far. You can give birth in a car. You can, with all the climate disasters, like you might not be able to get to a hospital, even if you're planning to seek this kind of care. I think that it's pretty clear that like maternity care in this country is one of the worst and has been for a really long time. It's pretty dangerous to have a baby in this country. We have infant maternal mortality rates that are up there with countries that we've devastated ourselves, like Afghanistan, stuff like that. Um, and I don't know. I think I know this is a little bit of a niche skill, but it's also something that probably, and maybe even hopefully for the better, more of us will be needing to use.
I
So
mean, statistically speaking, more people will need to know how to have a baby than to like shoot a gun. Like, there's far
yeah,
fewer instances of statistical or people that have like murdered somebody than like in self defense than like have had
that
to
is
deliver a baby. So
that's
like,
true.
as much as it's like, oh, this is this niche thing, like as long as humanity exists, half of the population or like
We
forty
will be
percent of the
having babies.
population will need to know, will be doing this thing that we need to have the skills to support them during.
No, I know. It's funny. I think about all the time, and especially the more I listen to you guys, like I'm at the point of just like, I don't know, going fully off the grid forever, never to be heard from again. But like, I'm in school doing for therapy, and it is so important right now. But it's also like, should I just go back to being a midwife? Like, we would exactly like you said, if there's anything guaranteed, and if there's honestly anything we can hope for, which is another thing I think the left kind of excludes parents and kids more than they should. But anyway, if there's one thing we should hope for is that we're continuing to put forth life. And I swear I say that in like the least, I don't know, puritanical or conservative kind of way possible. But it is. It's like,
Well,
what
if
else
we're
are
yeah,
we?
what are we building this all for if we're not going to
Right.
continue humanity?
Exactly. What yeah, why else would we want to survive? Why else would we want something better?
Yeah.
Mhm.
So yeah, I think the whole conversation around this subject is really important and interesting, and I think, like you said, the left sometimes, not sometimes, oftentimes, swings very hard the pendulum in terms of like, okay, since I don't feel comfortable with it, I'm just going to like say the most aggressively like pro blank 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 without like talking about the fact that, well, there these conversations are complicated and that's okay. Like life is complicated. That's
So
how it works.
complicated. So complicated. Yeah. No,
Yeah.
exactly.
Yeah, so I think that kind of frames up what we're going to talk about a little bit.
Totally.
Um
How to birth
so
a baby.
I I guess I'm going to put to you so that you can start talking about stuff because I don't know anything and I'll just ask you questions as you go.
Okay. So, when it's I've been told lovingly that I have a very like zombie movie view of collapse. So I'm trying to think of the best way to frame like emergency birth without like giving either way too much or way too little information. But
Do you
I
want me
will
to
say the
give a
good thing.
shot? I've got I've had a scenario playing in my head as we've had this conversation.
Okay, thank you. Perfect.
So
This is
like,
helpful.
all right, so
Um,
like when
mhm.
like the floods hit Houston during the last huge storm that went through, or like any of the recent like events, the when
Ida,
yeah,
mhm,
when Texas got hit with that freeze that
the ice
stopped the
storm.
windmills, like people are still delivering babies every day. So how are they doing that?
Right. So, how are we doing this? So, do you want me to describe labor or just birth? Like, should we talk about what to expect
What to expect when you're expecting?
when you're
Uh,
when you're expecting to give birth in a
when you're
disaster?
expecting collapse?
Yeah, right. Um, so, there are there are like four stages of birth. The first stage is like kind of like early labor. So, and I for yeah, ask a lot of questions because in my mind, still in my world, it's like everyone knows what a cervix does. Everyone knows, and that's just not. That's like
I know it exists. I
know
yeah,
that there could be or
there's
be
a
a
part of a
right,
body that women have that's called the cervix, and like
right. Well, okay. So in labor, it is the what the body does is it produces uterine contractions. The uterus is where the baby is, and
I knew that one.
okay. Oh, good. Um, and these strong, powerful muscular contractions dilate, thin, and soften the cervix, which goes from something that like it goes from being like as open as maybe like less than a fingertip to the size of like a bagel, if you can think about. So 10 centimeters, that gets the baby out. Um, and labor, usually if it's a first baby, It can take a long time. Second babies can go fast. Third babies are unpredictable, and then it just goes from there. So it's like sometimes labor can take a really long time, and it's important to know that like we've been doing this for like as long as we've been standing upright. It is a painful process, but it's also it is safe, like you said about how much we sterilize everything. Like we sensationalize birth especially so much, but it's like this is usually all you need to do if you're assisting someone who's giving birth is to like sit and watch or like love them if they need that. And so yeah, so there's that. Yeah, and then the but yeah, the first part of labor, you're going from 1 to 5 centimeters, and it's usually not as painful. You can talk through the contractions. You can still walk through them and do all of that. And then from 5 to 10, that's active labor. That's when it gets harder, and that like it can be more difficult. You might vomit, shake, believe that you can't do this anymore, but then you can. I
Don't
guess
have an option.
right. No, it's true. There's only one way it can go. And then there's the third stage, which is pushing. And that's usually where people get the most nervous. It's the most sensationalized. When I did midwifery and I was doing home birth, people who really weren't familiar with it at all, they always ask like what if the cord is around the baby's neck? They always think that that is the biggest and the worst thing that can happen, but really it's not. It's like a pretty simple solution. And I don't know how far into it you want me to explain, or if you have questions at this point, like if you want me to.
I think you're doing great.
Okay. So with the second stage, or excuse me, the third stage with pushing, that can also sometimes take a long time, just because the baby's like moving through your body. You need to like open up, you need to relax and push. It's hard work, but anyway,
Like choking down a bagel, pretty much, but the other way. Instead, going down,
that's
it's going up.
exactly. Are you're sure you haven't done this before? Because that's like exactly no. That's not what it's like. But anyway, but with pushing, the baby's head will start to come out. You'll want to sometimes apply a little bit of counter pressure to the perineum. I kind of wish I had diagrams. I feel bad. I have like midwifery texts and they're not around. Anyway,
All right.
yeah, you might need to put like a little counter pressure around. And then once the head's out, the baby will kind of start to turn. But this is where, you want to go in and check the folds like around the vulva and into the vagina where the baby's neck is, and just feel to see if there's a cord. If there is one, you'll try to slip it over their head. And usually, and then, the birthing person can push the rest of the way. Sometimes you might need to clamp it early. And I guess it makes sense to talk about like what supplies, like if you know that you're pregnant, if you know that you either like can't get to a hospital or that's a possibility, or I don't know, you're not planning a home birth. I don't know. You might do this alone. I can talk about supplies after, like at the end of the description.
Sure. Yeah.
Okay. But yeah, so you might need to clamp it if the cord is too tight, because the baby's not going to be able to come out that way. You want to make sure that the baby isn't taking too long. Like there isn't too much time between when their head is born and their shoulders. Usually, typically what will happen is they'll kind of like, the head will come out. There might be a little break. in contractions and they'll like corkscrew out. Sometimes though they can get a little stuck, and if that happens, you'll want well, the good thing about being at home and like not in a hospital, I mean, there are lots of good things about it, but you can move pretty freely. So one trick for a baby that seems to be a little stuck is to flip the person onto their hands and knees. And that will like open the pelvis and the baby should be able to come out. Yeah, but anyway, once the baby is out, you just want to get them up and put them right on their parents' chest. Cover them with a towel. I mean, thinking about, you brought up the Houston storms, you do want to keep things warm. If you have power or fire or some kind of way to like warm blankets, keep the baby warm, that's important. Skin to skin is really important. So you don't need to worry about like, I don't know, if you're in a car, if you're at home, wherever, like it's very important for the baby to be on the person who had them's chest. So like you don't need to do much once the baby's out. And they will come out. They usually look kind of like gray and floppy and stunned, and that's okay. You'll just like rub them, talk to them. They know your voice. That should get them going. I think we all should know rescue breathing techniques anyway, but definitely, again, if you or like someone like if you're pregnant or someone is pregnant and expecting, that would be something you'd want to start preparing for, like rescue breathing techniques, things like that. Maybe even looking at like diagrams. There are good like cheap emergency birth pamphlets. There are good old like anarchist midwifery zines that were like really pivotal for me when I was training. So like looking and seeing what this could be like for you and being prepared as much as you can is important. But really, once the baby's out, it should be okay. They're going, again, like I said, they're slippery and they might not look as alive. But they'll, that's normal. Being born is really hard. Then there's the fourth stage, and this is where really like the most complications can happen, and that's the delivery of the placenta. And when the baby's born, like you don't need to cut their cord right away. You can wait. You don't need to worry about that. It's best to just, unless it's like an emergency where you do have to do rescue breathing or something, they really should just be up on someone's chest. But anyway, the placenta, so usually that is born about within an hour after birth. You'll kind of want to monitor the bleeding, because the biggest risk with both like abortion and a miscarriage, birth, is hemorrhaging. And this is the stage where it tends to happen the most. And hemorrhages happen really, really fast. And they can be, I don't know, they just can go downhill so quickly. Yeah.
Yeah. So I think like when we're talking about like the birthing process, I understand at this point, like, okay, you get the baby out and then they're pretty good. Now in terms of like, I guess like the most common complications, I know you talked about like the cord. Is that like usually the most common complication that like is easily remedied?
No, it's not that common, but I think it is easily remedied. I think that's something people think is like the worst thing that could happen, and it's not, for the most part. No, it's the hemorrhaging, I would say, is
even with like normal births.
Ones that like, yeah, no, and that's the thing. You can't, a lot of conditions in pregnancy, and this is something that's difficult because I feel like, well, and I know, you're you talk about this. We're a lot less healthy now. And so, a lot of us have issues with blood pressure, diabetes, things like that in pregnancy. And those, those you see coming, but things like hemorrhages, you don't. You can't really predict if it will happen. There's some situations where they might be more likely. One is a precipitous birth, and that's when a birth goes like really, really fast. Typically that's considered like start to finish less than like 2 to 4 hours, just very, very quick. Or a shoulder dystocia, and that's where the baby's shoulders get stuck. Usually babies like that, they get stuck on the pelvic bone. But and usually they tend to be bigger babies, and it makes the uterus like not be able to contract enough to get the placenta out, and then it just keeps like bleeding needlessly. But anyway, so there's but for the most part, yeah, you can't see that coming, and it's not always the easiest thing to manage at home without being like having some kind of skill. But there are things that you can do to try to prepare and to, I don't know, at least be able to alleviate the situation, because it's not something like wound care where you can pack it really. Like a uterus, you have to,
It's in your body.
it's in your body. Yeah, it's a muscle, and it's
Yeah.
So
Yeah. Okay. So I guess let's move the conversation over to the other side of this, which is the emergency abortion care.
So I want to say first, like I have always gotten so many questions about herbal abortions, and the tradition of everything that I was taught in was not one that encouraged it, and it put a lot of fear about them. And so I can't speak on that. I think that there are a lot of like indigenous sources and maybe other good sources, because we have used that kind of care for like the majority of our existence. But I guess
Sure.
I
No,
don't.
I wasn't thinking about like how to do it, but
Oh,
more
like a
so.
DIY. Okay. You were
No.
thinking about what to prepare for.
Yeah, like what you should be being aware of and things like that.
Sure. I mean, that's the thing. I took some note because I feel like because for both birth and abortion, but I think abortion especially, and especially with the left, I think when we think about it, we think that to defend it as a right, we have to kind of like sanitize it to the point that it is not something that is often a really complicated and difficult thing to do. And that it can also, that it's not easy. Like the pills that are available, it's two that you take at once. But anyway, it's a painful process. It's a visceral process. And you will have to see the products of conception. Like you'll have to see the tissue. And there's a lot of aftercare involved. And I think that's not discussed as much as it should be in an attempt to kind of make it to defend it. But it's like, I think the ways that we can downplay that, or even like the pain of birth, we kind of want to remove ourselves from the reality of it, and it doesn't allow us to then kind of be fully prepared for what an enormous experience these things can be.
Yeah. And I think part of that speaks to like what you're saying is almost like a binary between like, well, if the right is going to paint like a 10-week pregnancy as like basically like like a baby, our response is that it's like it's so small, it's basically nothing. And like
Right.
it doesn't have to be either or. Like we can acknowledge
No,
that there's like a
no.
space in between, because it is a thing that's in our body that again, like you said, we've been doing this for thousands of years, and like we can engage in that conversation without it like in any way uh reducing our position on it.
I know, but can we? I hope we can. I mean, I think
Some of us can, yeah.
some of us can. I know you're absolutely right, and I think yeah, we have to. I think we have to exist more in the nuance of virtually anything, but definitely when it comes to yeah, the bodily autonomy and even just the like bodily connection, what community and solidarity will look like, what you might need to do for other people, because that is also so essential with um, the full spectrum of reproductive care. I mean, the full spectrum of life care. But yeah, but I think so that with the abortion aspect too is that like when you get the if you're able to access the pills, oftentimes they won't, if you go to a clinic, they won't give you pain medicine. They won't do anything like that. They usually don't explain as much as they should either. And like you have to be prepared to almost go through labor. So you might like vomit, you might have diarrhea, which I guess I probably should have described what labor can be like a little bit more, but it's hard to like walk the line of like what's emergency necessary and what is like, oh, I'm teaching a childbirth class.
Yeah,
So
well, I would say like I think most people are, I don't want to say aware, but like we've seen that, like I don't think anyone is just going to say like labor is like not a painful process. Um I would say most people are going to recognize that it's like a very strenuous thing. Whereas I think abortion, on the other hand, especially like first trimester abortion or something like that, is very
you think
much
it's a
played
walk
off.
in the park. Yeah.
Yeah.
And it's not. I mean, no, you're right. That's true. I think that's a good point. I mean, I will say when I worked in the home birth community, people who have these ideologies, not everyone, but some with natural birth, they have these thought like that you can like hack your way to it being, it's like, oh, if you breathe or if you meditate or if you whatever, it's not going to feel like your body's being ripped in half. And it's like, no, it will, but then it's
Slightly
over.
less.
And right, and it's like a process. I don't know, like anyway. But yeah, so with the abortion and that too, hemorrhage is something in that situation that can happen fast, and it can happen it can be more likely that an infection, and you have to be really careful. I think it's also something that like even if you think that you may want or need to be alone for it, um please don't like have like we are animals, like giving birth or going through something painful like this, something where there's probably grief you can't even really consciously access. There's a lot going on, and I mean like physiologically, but um you yeah, you just we want to sometimes crawl into a dark cave or do something like that, which, I don't know, like a that I guess these days would be like a bathroom, but still have someone like on call, even if they're in another room or like down the street, have someone there because when you're ending a pregnancy, even with the drugs that they use, which are super effective, things just can go wrong so quickly, and you won't it's not something you can contain or handle on your own. um
Yeah. I think, again, to go back to your example of like the left, like having a really hard time like wrestling with this idea of abortion, like a lot of that is minimized in the goal of um I guess giving trying to support women's autonomy,
right.
erasing like the very real risks and concerns and struggles that come with these processes.
Right. And I think it's also important to acknowledge with abortion. So there's, similarly with birth, um, if there's a climate disaster, if something's going on where you can't get to the hospital, if it's full of COVID, if it's shut down. I don't know. You have to be prepared for those situations. You also oh, I lost my train of thought. I was reading off of something. Oh, you also have to consider that, like right now in Texas, uh, like you and this too can be the case for some home births or planned ones, or if they suspect it's unassisted. The state is getting involved in really like sinister and insidious ways with reproductive care. Not that they always have, to be completely clear. Like the right to parent and to raise children in this country is one that is just not and has never been equal. But if you do for some reason need to go to the hospital for any of these situations, like an at-home abortion, if it's not like, you need to say that you might need to say you're having a miscarriage. You might need to deny parts of your experience so that you don't get in trouble. The same then also goes with having, like, I had one of my children at home and CYS, Children and Youth Services, got involved. This was in PA. Like they were doing a lot of midwifery investigation at the time. But anyway, like be prepared for scenarios like that where if you're going to get help, you have to explain your situation in a
In a
tactical
context.
way. In a
Yeah.
tactical way, yeah.
Yeah. And that's wild though in Pennsylvania. Like I think we think of Pennsylvania being like the Northeast and at least a little bit more
Amazing Dixon Langham, sorry.
pragmatic. And I get it. Like I've been out to like Lancaster and like out towards the middle of nowhere, York, and
Yeah.
it's much different there. It doesn't take long to get away from Philadelphia to be like
No.
basically not in the
Oh,
Northeast anymore.
no, not at all. No. Oh, no, no. It's a different world. Even the Lancaster Amish, they were considered like touristy Amish. They weren't like as old order as some of ours, who we worked with. But yeah. But it is.
So are there any other concerns with like abortion at home
Mhm.
outside of the bleeding?
Oh, so infection. And that is also something to look out for with birth as well. So you're going to want to monitor, like there's, and that's another thing to prepare for after both. But with abortion too, and they don't always explain this, especially with when you're not doing a dilation and cutterage, a DNC. So a surgical abortion, you're going to bleed. You're going to bleed for about 4 to 6 weeks after. It'll be like a heavy period at first. It's going to be clotty. But with infection, and with with both birth and abortion, you can get some tissue can be retained after either, and that can be really serious. You definitely would need medical attention for that. But you'll be looking for like smell, like of the discharge if it gets really bad, fever, chills, things like that. 4 to 6 weeks. Yeah, it's a long time to bleed. Which is the other part, is that nourishment afterwards, after both birth and abortion, and hopefully before, like trying to like take rest really, really seriously, monitor like what feels comfortable and right, eating as well as you can. Yeah. Very
Yeah,
important.
it's something that like goes directly in the face of like the world we live in. Like no one can take that kind of time off for an abortion. You can't even bring
No.
it up at work, never mind take
No.
the time off for it.
Oh, no.
Um,
Well, no. And depending what kind of jobs you work, there are people who are going back to work like 2 to 4 weeks after having babies. I mean, it's it's devastating. I mean, yeah. Yeah.
yeah. Um, So bleeding and infection
Mhm.
are probably the two biggest concerns.
Mhm.
Is there anything else that people should be aware of?
With abortion.
Yeah.
Um, those are the two biggest ones. And I think so one of my favorite, like, I think they call this like nurses opium or something. Um My favorite, one of the pain relief tools that we would use in midwifery for after birth, after a miscarriage, with abortions, because like I said, there, if you're getting this from a clinic or if you're getting it in the mail, the pills, you're not going to be, like, more than likely you're not going to be given anything other than extra strength Tylenol. So for pain, um okay, this is the nurse's opium. So you take 3 extra strength Tylenols and 3 ibuprofens at once, and then alternate them according to what the appropriate, like, dosage spacing is. I think it's like every 4 to 6 hours for the acetaminophen. Sorry, I use the name brand. Yeah, acetaminophen or Tylenol, ibuprofen. Um, I did write that down.
Yeah, that's something I used to have to do with my kids when they had fevers.
Double dose
And
them.
yeah, double dose them
Mhm.
and rotate.
Well, it is, and it's important to know this too, like, if you've struggled with opioid addiction or anything like that, and you're uncomfortable taking that for pain, like, we call this the remedy in our house. We do it for the kids sometimes too. We do it for the kids too. But yeah, it's 500 milligrams of acetaminophen and 600 milligrams of IB. Oh, but yeah, it works as well as narcotic pain relief, without the addictive aspects of it. Sorry, wanted to say that. Anyway, 500 milligrams of acetaminophen and 600 milligrams of ibuprofen at once, and then alternating the doses of the 600 ibuprofen every 4 hours, and 3 to 5 milligrams of acetaminophen every 6 to 8. So you can adjust that lower, but do not. Oh, thank you. Yeah, sorry, I'm the in the US. Um, Yeah, but don't exceed the, you can, yeah, adjust the dosage lower, but don't exceed that. Heating pads, calming smells, TV shows, like music you like, if you have power, if you can do that, but dim lights, weed and CBD if you do that. Showers, you can't do baths, because that can increase infection risk. Um, those all provide really good pain relief. You'll want to do like light snacks. Um, the big thing with hemorrhage, and this is the case for both abortion, miscarriage, birth, hemorrhage can sometimes be caused by a bladder that's too full. So make sure you're drinking a lot and peeing a lot, even if it's uncomfortable. Um, I'm not an essential oil person, but this is a good trick. If you need to pee, you can either put peppermint essential oil drops in the toilet if you're able to sit on that, or on a warm compress and like press it over the urethra, and that can help um, you pee. But that is something that's important. Make sure you're peeing and drinking and eating, and if you're able to. Yeah.
Awesome. Um, so I guess like I want to know your thoughts as somebody that's worked around this. Uh, when I had reached out to you about this because I knew that we talked in the past that you'd been doing this in your previous life. What I guess kind of what we're talking about before, like how important do you think this is going to be in the future, and like what what are next steps for people that are like, holy shit, I never really thought about this.
Mhm.
I need to get more involved. Like what can they do?
Um, Well, one, I think that'd be really cool, because I do. I think that I think renegade medicine in general, which is how I saw midwifery, renegade medicine in general is going to need to be happening more. And I think for safety reasons, for accessibility reasons, it's probably something that, yeah, we should have been maybe better equipped with, but should have, I guess, is the case with a lot of things. Yeah, I think it's going to be really important to learn more. There are a ton of like really good midwifery and like doula resources. There are like on Instagram, there's autonomous pelvic care. Um, some of the harm reductive groups are pairing with like doula and midwifery organizations. I know Eastern Harm Reduction, I think they're in Knoxville. They're in Tennessee, Eastern Tennessee Harm Reduction. They're pairing with the Knoxville doulas. They have good information. There are some like indigenous midwives. I think there one, I think she's Maya Doula. She's I think an indigenous Mexican midwife and doula who provides a lot of really good like herbal information, way better because like I said, I was trained to use herbs, but I'd never be comfortable speaking on it as much. I know more about like the pharmaceuticals that you would keep on hand in emergencies. So those are important things I think to look up. Getting like manuals and pamphlets I think is important. I've been trying to think a lot about ways that we kind of like can gain skills and knowledge in a guerrilla type of way. Like we don't need to be certified and credentialed and like accountable to the state in all these ways to have these skills and be really like prepare, have a certain like ownership over them in our
Yeah.
own right.
Yeah, I
um
think something like a Skillshare would be great. Like
yeah,
maybe like a
yeah,
YouTube or
doing
a Twitch
those.
one. Like, yeah, that'd be great.
Right, and if other people know, I mean, that's the thing, I haven't had as much success like finding where like these kind of like street medic harm reduction groups are coinciding with more of the reproductive spectrum, and it feels really crucial right now. I might just not be looking though in the right places, and so if other people do, I can also give you, I can like look and give you the information later at some point. But yeah.
Yeah, I think you're right. I think there. I mean, just from the fact, like looking at the response that I had when I posted this on the Reddit channel, the Red Prepper Reddit channel.
Mm.
Um, I usually post the streams that we're doing on Skillshare, and usually they get like 10, 20 likes. This one had like 65 likes, and I was like, everyone recognizes that this is something that we don't have.
Birth is
Whether or not
really cool too. I mean, I have to say it's
I didn't think
cool.
so, but
No, you did.
we'll
Well,
trust
I was
you.
about to say it's like you don't have no experience. Like you've given birth, although I'm sure like I think Red, my other, I like this is a project I do with my partner, but I think he's dealing with one of the aforementioned kids. But like maybe he would have a different story about birth. But it's like I think I don't know. I think to be able to like sit at someone's feet as they're giving birth is it was for everything I've done, it's probably been like the absolute greatest honor of my life. And I don't know. And I've sat with people through, I've diagnosed a stillbirth. I've sat with people through, just everything about life. And I think I don't know, it's very affirmative and it's very, and it's gross and it's weird and I don't know, and it's like sexual, it's a lot of different things. I guess that's where I start to get kind of hippie with it, but it's I don't know, like
It's
yeah,
very primal, I think.
it
It,
is
it
primal, it
like
is
speaks to like
primal.
this really like animal part of our humanity that there's no way to really erase it. Even
No,
like even in a medical setting, it's still like graphic.
it's true. Well, and it's so funny too because like like little old women, who, before they were knocking people out before births, a lot of times most of their memory would be gone. And still, what they could speak of was their experiences with birth and with, you know, yeah, raising their children, especially as babies. And I don't know, it's interesting because I think we fail to examine the like capitalist, the really internalized capitalist aspect of, and certainly white supremacist, of like our rejection of parenting, why abortion is so fraught to begin with, um why the like best narrative we can come up with around it is like, well, I can't have this child, I have to work, like, and that's like the acceptable sterilized version of it, when really more often it's like, I can't afford this baby, I might not be able to feed this baby, it's like, it's devastating. And
Yeah.
I think, yeah.
Yeah, I mean, obviously, capitalism has rendered parenting as something exclusive to people who are either
Can afford it.
fairly well off or people that have basically accepted the fact that they're never going to move up from their place, their status, because it's
Mhm.
basically impossible
Mhm.
between the cost of daycare and like the time it takes to work your way up in a company or something like that.
Right.
And then again, I feel like we should talk about this just a little bit, and then
Oh.
I'll let you go.
Mhm.
But like you had brought up this idea, like the left has like a really hard time like talking about like abortion, but
Mhm.
also like the left has a hard time talking about parenting. Um,
Oh, I don't know which is harder. I mean, they talk about abortion, but in, I won't say the wrong ways. I say ways that lack a lot of footing in reality and nuance. But parenting, it's like,
yeah, it is probably the one area that whenever I talk to people and they're like, "You're a dad? You have like multiple kids?" And like, "Yeah,
oh, I
I do."
know.
And it's a weird subject because it's like, well, you not only are you like, you don't want to feed the machine, so to speak, in terms of like providing labor, but also like, especially me, like you're always talking about collapse. Why would you bring children into this world? And like, there's a weird defense that comes with like the territory of justifying having children.
No, you're so right. That is like an excellent point. And it's funny because, so one of my, I really don't like sounding like an academic asshole, but one of my theses was on um like abortion, like middle class ideologies that are imposed on like life trajectories and how it affects like motherhood for people who are like poor and working class. And it's like a lot of people know they're never going to college, like these things are never going to work out for them, the dream is not there, and one of the most like affirmative experiences of their lives and definitive of adulthood in a lot of ways is having children. And I think, people don't want to discuss that. Yeah, there's that. But then there's also, oh, I might have forgot my other point. But yeah.
Yeah, I think that's really important because, especially, I think our generation, and I think you're about my age. We're
Mm,
millennials, right?
yeah.
So I think our generation was so infantilized by our parents because our parents
Oh,
never really grew up. So like rejection of that youth in some capacity, I think is really
oh, we
significant
can't give it
for
up.
yeah.
No, you're
Uh,
totally right. Well, it's fun because I had my first, I had been doing like leftist shit since I was like, I've only been a mother and been doing left stuff, like, and I like, those are the two longest things in my life. Like I had my first when I was 16. They are now 16. um, so it's like, I don't know. And there was like always walking like a weird line. Like I'm here and I'm in these spaces, but oh, I have kids. And there are some people who were very, who can be very comfortable about that. And others who it's like, how could you ever like, why, like, how could you ever do that? But oh, but then that's goes to my other point. I have friends who are asking me now, like people who have struggled a lot with fertility and are pregnant now, people who, have wanted to have children for a long time. And they ask me a lot, and I'm sure maybe they ask you a lot too. They're like, should I have done this? Should I even be doing this? And it's like, what else are we going to have? It's like you've wanted this for so long, and it's like there is no life certainty. Like, please enjoy this. Like, please truly like live this experience, because it is probably at this point like one of the most human ones we can have. And
And in
it's like,
some
I
ways,
don't
like the only
know,
one we can do that's like free, technically speaking.
technically speaking, yeah, technically, yeah. No, it's true, it is, it's free. Babies really don't need that much. And I'm not saying, I'm certainly not like a, what would you call, I'm not like a, like, I think, a natalist at all. But I also think that our relationship to, and you guys I think talk brilliantly about this, our relationship to what is important and worthwhile, amidst the anxiety and the fear and like fashion, all of these things. It's like, amidst all of that, it's like, what are the things that we can, I don't know, kind of use to, I don't know, to enjoy. We're in a life where there's so little of that at this point, and also to, I don't know, maybe move forward. Like, yeah.
Yeah, and I think that comes back to something you brought up earlier about like this idea of why are we doing all this stuff if not for future generations to improve
Right.
upon or enjoy, and like those generations need to come from somewhere. Conversely, um, the idea that because we're poor, working class, whatever, that we shouldn't have kids because of our politics is
Oh, I
also like
know.
really complicated and problematic because
Hmm.
there's this very classist element to it.
So classist,
Um,
so racist.
yeah, and
Hmm.
it's really messy, and um, it's okay to engage with those conversations. I think it's
It
important to
is.
engage with them because otherwise you end up in that same space like we were talking about abortion,
Hmm.
where the conversation is just yes, 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 and there's no like dialogue about like let's actually talk about this subject matter, and that's
Right.
continuous across not just like abortion, but like most intersectionality where the left is so uncomfortable talking about things like race and
So
identity,
uncomfortable.
but we don't we do the opposite. We project so much about like we support like this big capital W,
Yeah.
and
And then don't.
but then like we don't examine those critical nuances of like
No.
okay,
Yeah.
go ahead.
No, no, I'm just, you're so right. And I think there's a lot of like prescriptive, I think people don't realize like how in the same breath they can be like, we can't be cops to other people. And then we will be like, parents, don't you realize like what awful like fascists you are sending your kids to be indoctrinated at public schools? And it's just like, who's starting the childcare collective with me? Because I'm ready. Or, oh wait, I'm sorry, you think kids are gross and disgusting and lame? Like, cool. Like, like, if you like, there are lots of like, I don't know, serious complications with our abilities to be radically empathetic, to really grapple with what mutual aid would look like, what alternatives to, capitalist systems would be, what it means, like what is like more of mutual aid, and like what is more like in solidarity than helping people like through like experiences like abortion, birth, parenthood, death, loss, illness, grief. Like that's like the point of like the most like, I guess, like, yeah, sinister tool of capitalism is how much it's alienated and isolated us from one another, to the point that we're like, can almost be like eco-fascists on the left about um
About purity.
reproduction.
Yeah, and like the thing I love to say, and I literally said this last night, so if people are watching from last night, then I'm sorry, you're gonna have to hear it again. Is like this idea that like as an anarchist, part of my belief in anarchy is that like not everyone should be an anarchist. We should
Right.
not all agree in lockstep about everything. That's part of like being human, that we don't
Right.
agree on things, and that's
Hmm.
okay. That doesn't make somebody a bad person or even an incorrect person. And
Hmm.
like what's buried in that conversation is that there's an objective right or an objective truth, and like we believe what we believe, but
Right,
like
the binaries, yeah.
yeah, yeah, like, just because I believe that I'm right about ecology and anarchy and all these things, th there's no way to ever know
Mm-mm.
that is right, just any more than like somebody could ever say in objective terms that having children
No.
is bad.
No.
Um, and
Mhm.
that's where the left and the internet, I think, just like creates this like disgusting like echo chamber that just like eats itself over subtle nothingness, and it just drives
Mhm.
me crazy.
I know. I think you guys are actually like some of the absolute best at talking about this.
I think I just try
Um,
to anger as many people as possible. That's usually my goal.
God, is that
Yeah,
hard?
I'm a natural like instigator, so
Yeah.
yeah, it just it's one of those things that just bothers me a lot because it's like you know we have these like two very distinct points that the left tries to make. This idea of like the workers of the world unite, and also you're getting canceled for using the term like slave instead of like person
It's
enslaved or
mhm.
something like that, where it's like how do you bridge these two totally diametric positions?
See, that's so funny because the one thing that makes me want to not completely drop out of uh like school and continuing to do therapy and stuff is that I believe we need to be like so desperately rid of that internalized capitalism, like that we don't even see it on the left, and we point out fucking everything except for the real thing that it's like we're so like we cannot get around the binaries, like you said, we cannot get around this need to be hawkish with other people, like we and this idea that things can ever be like objective, that like your experience is the experience, like you said, like you are an expert on some things, but it's like we also only know like what we know, what we have access to, what we um have lived through, who we know, where we live, like so many things. It's like everything is contained to that. Like there's just I
Yeah,
don't know.
there are experts in many fields that like completely disagree with each other, and that doesn't invalidate either any of those
No.
people because they disagree on things because like shit's complicated.
So
Like that's what it comes
complicated.
down to,
No,
and like
so complicated. People are complicated. It's just so complex, and we actually don't need to know about it. Like why? Like I wish we had more imagination. It's like it's sad. It's like
yeah, I was watching this show, and I won't name it because I don't want to ruin it if someone's watching it. And at the end of it, the travelers end up in North America, and they meet with the indigenous people, and like the presentation of the way the indigenous people live is completely different than the world that they had come from. And in that process they're thinking about like, okay, like let's replicate where we came from. And one of the people that had come with them was like, well, if we just replicate the thing that we came from, we're going to end up leaving again because of the same reasons. And like this idea of like thinking outside of that scope of the way you think things should be, and that like just because you haven't experienced things before that you don't have, or that maybe it's impossible, or that
that it
um
exists, right?
yeah.
This absolute like necessity for proof of everything, while also really not having a lot of trust or faith in any of the proof that you are given. And I think necessarily so, but it's like, yeah, it just, that's a good point.
Yeah,
Mhm.
so we kind of got off topic a little bit on abortion and birth care, but I think it's all really important and part of the conversation about kind of how all this stuff ties into the left, and the fact that, like I said, that so many people recognize that there's this gap. And we could talk further about the fact you brought up like street medics,
Yeah.
that there are challenges with street medic
Mhm.
because of the fact that they're usually underqualified for some of the things they try to do. And like again, to talk about what we were just talking about, this illusion of like objective truth and knowledge that
Mhm.
somehow because we can't be bad, we have to be good and perfect. Therefore, like we are fully capable of doing things we're not capable of. Um,
Absolutely.
so,
Absolutely.
there's a whole subject matter we could talk about around that part of uh, human care, let's call it. But I think we
Yeah.
should,
Mhm.
I think we should probably wrap it up. Otherwise, I don't want to keep you here all night.
Sure.
Uh, I know you've got kids, and the few hours without them are pretty important,
There that's what I'm saying,
especially
like,
in the world of COVID.
like, if I can find some, like, really good, like, anarchist babies that, like, let's or other anarchist parent, like, please, guys. It's,
You
like,
can
commune
move,
and
like,
collective
just come
time
out this way.
now.
It's a couple thousand
Like,
miles, or start the
for
commune. Those are your options.
exactly. Well, but I think, okay, if I could just I think that's what's important, though, like, back to the street medic, stuff like that, being in like, aware of your community, like, get to know the local midwives and birth workers. Get in solidarity with them. Have their number. Like, have learn from them. There are in a lot of bigger cities, there are it can be easier to find a lot more people, but still, in rural areas, there are a lot of them. There are a lot of like Black and Indigenous women who have we like have the birth knowledge that we have in this country, like the like solid time, the time that can stand the test of time. Like everything we have is because of them. And there are a lot of, because midwifery training can be so prohibitive in a lot of ways. Like that's a great place to put like, you know, um, money if you want to help people, or like, I don't know, to just work on like organizing trainings on that kind of stuff for people to do that, for, to support those areas and those people, but to be in community with them, I think, uh, would be a smart move.
Yeah, I agree. And I
Mhm.
think that also boils down to the fact that, like you just said, most cities, meaning alternatively, that um, per capita, there are not many people with these skills.
Mhm.
And that means that not only are they in demand because of the fact that, like we were just saying, literally 40% of the people around you will give birth at some point in their life,
Mhm.
but also like that you have to work within the confines of the community you live within, not in an idyllic,
Uh-uh.
left only eco anarchist only commune or whatever. Like that's not going to happen. So alternatively, we need to
Oh
make
no.
the conditions where we live work. Unless you've got a bunch of money and you're going to buy a bunch of land and fly me out. So, uh,
No.
barring that, we will have to live within the confines of the communities where we exist, and that means working with a lot of people we don't agree with on a lot of things, and
Which
building
is
those
true.
inroads.
Yeah. Right, right. Some of the midwives are going to be like in rural areas, they're going to be a lot more religious. But I don't know. Yeah. And that might be uncomfortable. But keep in mind they know how to do stitches. They know how to um stop hemorrhages. They know a lot about healthcare. Like I said, a lot of times midwives were the care providers in communities. So it is, I think it is a little more full spectrum, and yeah, it's smart to bridge any gaps that are necessary because they can bring a lot to the
Yeah,
table.
we need the knowledge.
We need it.
So Liz, um,
Mhm.
thank you so much. I also
Thank
want to give you
you.
like 2 minutes to tell us about Listen Left a little bit and where people can support you guys.
Sure. Would it be annoying if I got Red? Actually, he might say no if I got Red to be like, he's better at explaining it. But anyway, okay. Listen Left is a project. We've been running it for about a year and a half. It's a free, accessible, audio library, accessible to a lot of needs. We, like for it to be more, but anyway, free accessible audio library of revolutionary, radical, leftist, post-left texts, and we're always growing it. So yeah, we are most active on Instagram, so it's just at Listen Left. We have a website, listenleft.org. We also have a Patreon. So if you want to support us there, you can. We send books to prisoners, and we do, mutual aid donations every month, even though the project runs on a really big deficit, but it doesn't matter. I don't know. We felt like it was something that's really crucial for people to have access to. So hopefully you can take the theory, it can be accessible to as many people as possible, and you can go and then do praxis and
Do cool shit.
Cool shit. So much cool shit.
And you guys have a Venmo, right?
We do, yeah. ListenLeft.
Yeah,
It's all just ListenLeft.
Yeah, so if people want to throw a couple bucks your way, they can do it on Venmo too
You
at
can, yeah,
ListenLeft.
you can.
Or Patreon. Highly recommend it. You guys are doing great work. I
Thank
love
you.
to
We hope
promo
to
you
pick it up
guys.
more.
Yeah.
Yeah.
You guys are going to be running a commercial on one of our episodes soon, which I'm super excited about.
We're excited too.
So, I'm happy to see you guys doing cool stuff and happy to chat with you.
Well, we're happy to be like in solidarity and community with you. We kind of started at the same time, it seems, so it's good to be like, yeah, happy to be your comrades. I'm gonna hold on to the anarchist commune dream.
Listen,
I don't know.
you set it up and I'll be there, but
do a GoFundMe for that. These crazy truckers in Canada got 10 million together. Like, surely some of us can do something.
It would be cool.
It'd be cool. Yeah.
All right.
Thank you.
I'm going to kick you off and I'm going to say my goodbyes.
All right. Thanks.
So, guys, hopefully you enjoyed that. I sure did. So thank you so much for tuning in, especially folks that stayed the whole time. If you guys care about what we're doing, or if you're not familiar with what we're doing and you just happen to tune in, go check out our podcast, which you can find anywhere, Poor Proles Almanac. You can also find us on Instagram, again, at Poor Proles Almanac. We release episodes early to our Patreons. You can go listen for as little as $2 a month, 7 cents a day. Gives you early access. Costs about I think I did the numbers once and it was like 1.5 cents an hour of content, basically, is what that costs you. So it's definitely worth it. Plus, it helps support stuff like this channel. What else do we do? We also have some YouTube video content up as well on how-tos. And we're going to continue doing more of these Twitch prepper skill shares. We have a AMA coming up on Sunday night, one of those. So you should definitely tune in for that. Apparently now we can do subs, so I don't know what that means other than being a sandwich, but I think it means you can subscribe and you can kick a couple bucks to Twitch, and we get a good chunk of that. So if you guys enjoy it, you want to sub to it, I guess is the term, please do. It helps us, gets us more attention, more money to continue doing this stuff and just paying our bills and feeling like people care what we're doing. So until next time, guys, my name is Andy, and this is the Poor Proles Almanac.